What's up, everyone? This is gonna be a quick video today. If you're new here, I'm Diamond. Welcome. Don't forget to subscribe, bell, something. It's free. If you're returning, thank you. I do appreciate you guys watching my videos, but as you can tell, this is a different atmosphere as normal. I'm in my car, but I just really wanted to do this update video. Not even an update, it's just some information that I had people reach out to me and ask far as what to do before going to the DR for surgery, far as doctors, medication, and everything. Disclaimer, I am not a doctor, I am not a medical professional. I am just giving you guys my opinion on what you should do to be safe when going into surgery, and especially if you're going to go have surgery anywhere in the world, whether it's in the United States or outside the United States. There's a few precautions and things that you should do. Have your own discretion on the doctors that you choose and health issues. So I just wanted to give you guys my insight on what I did beforehand and what doctors told me to do before going to get surgery. So the big question is, do I get my blood work here in the United States before going to surgery? Yes. It is highly recommended that you get your blood work done here. It's not that if you don't, you can't get surgery there, but it's it gives you an insight on if anything is wrong, what you need to work on, far as if you're anemic, your of course your hemo levels, because certain doctors, they will not perform surgery on you if your hemo is not at a certain level. If you have any deficiencies that you need to correct, far as vitamins, if you need more vitamin D, vitamin C, anything that you might want to take care of before going to go have surgery. Also, as not a common courtesy, but you should want to talk to your primary care doctor just to see if you have any underlying health issues that you will be okay far as going to go have surgery. Because, and I know with the DR and anywhere else, some doctors will not perform a surgery on you if you're diabetic, overweight, you have some type of underlying medical condition that can be really detrimental to you if you do decide to go get plastic surgery. Like I said, it's not, they're gonna do blood work and all the testing on you once you get there, but there's no reason on spending your money and booking a flight and going to a different country just to find out that, hey, I can't have surgery because something is wrong with me. Oh, my heme levels is not right. So it is, just do your due diligence to try to prevent any of that. And just for your safety alone, you should want to know what's going on with your body. Before I left, I did have a stress test done. I had my heart checked out. I had all my blood work to see what all my levels were. One my doctor did was check how well I clot. And I listen, like I said, I'm not a doctor. I guess clotting stops the bleeding if you bleed too much or something like that. So that was a major thing that he wanted to make sure. But overall, your primary care don't really give you the go ahead. They just give you their recommendations just to say, hey, you're okay, you can move forward with this surgery. Another thing is, of course, plastic surgery is not weight loss surgery. If you're having a hard time losing weight, don't expect to get plastic surgery and it's gonna get rid of all your weight issues. That's not how it works. You still have to eat healthy. You still have to try to lose the weight, because when you're gonna go get plastic surgery, you're trying to set a foundation. It's not a magical thing. Hey, I'm really big, I don't like how I look at all, but I don't want to lose weight. I don't understand how to eat healthy. I don't want to eat healthy. It doesn't work like that. Just transparency. If you're new to my channel, you may not know. If you've been viewing my videos, guys, you know I had bypass surgery. Granted, I don't eat a lot, but I still had to eat healthy and prepare myself, take my vitamins before I went to surgery, because it's not just, hey, I'm gonna get extra fat taken off me. No, the weight that I went on the table as, I came off the same weight, still the same weight. I didn't lose anything. So just prepare yourself. Try to do the right thing, basically. Another question is coming home post-op care. Spend the money post-op. Don't try to finagle your way out of, and cut costs. Your post-op care is just as expensive and just as important as preparing to go get your surgery. I get it. Amazon has fajas online. Some are good, but if you really need and you want that good compression, go to a professional. Go somewhere that actually specializes in fajas. Your own personal measurements are important when it comes to compressing. Don't just putting a faja on is not the same thing as having one just bought off of Amazon. You have different levels. If you're stage 1, 2, or 3, it's important. It matters. What else have I had people ask me? And don't just, these doctors are not playing when it comes to deposits. Stop sending money and you know that you're not ready. Don't just, oh, what is that underneath my nails? Y'all seen that? Ew, gross. Okay. I was painting last night. It's paint. Stop sending money to make a deposit and holding up a space if you know that you're not ready for surgery. These doctors are not sending it back. Just don't do it. You can book a spot when you know that you're 100% ready and you've lost the weight, you're at the certain BMI, you understand your post-op care, you have everything in order, what you need to do once you get off of the table. These doctors are not playing. They're not giving refunds, and some doctors are only allowing you to transfer 2 or 3 times, and then you lost your money. It's no reason to lose your money. Surgery is serious. This is just not a joke. This is not something that you just jump up to go do because you've seen everyone else do it. Like, this is life changing. Some girls go in on this table and they don't get off of this table. Don't just go to they look good, they're giving out promotions. That's not important. Your life is important. What you do afterwards is important. Every aspect of this is very, very serious. This is not just, I want to be a baddie, I want to be an IG baddie. That's not how this works. Like, you might feel like, okay, it ain't that serious, my homegirl went and done it, but you and your homegirl are not the same person. I'm trying to think. I've gotten a lot of questions, and I don't want to say like it's common sense questions, but my biggest thing is preparing to go is just as important as your post-op care too. I want to say about 2 years to even prepare for this. Take your notes. I have notes down. I watch plenty of videos. In case stuff go wrong, find out what you need to do. And especially find a doctor that once you come home, they understand that you had surgery and they're going to help you and they're going to assist you. Not all doctors are really willing to take on a patient that went outside of the country to have surgery. My primary care doctor, he was okay with it. Me and him, we sat down, we had a conversation. He knew what I was going to go get, and he did not have a problem with it. He gave me some of my medication, and he was fine. I came home with my drain on, and that's one thing that I didn't think about really, because I didn't think I was going to come home with a drain, but I did. I went to the hospital. The hospital, in emergency room, they didn't want to touch me because I went and had surgery overseas. And when the moment they said that, they just wanted to look at me. They didn't want to take my drain out when need be. So luckily, I messaged my massage therapist. She took it out because she's trained in it. You need to have a backup plan once you come home. everything does not go well, and not all doctors will be open to dealing with a patient that has went overseas to have surgeries. Another one, stop trying to give yourself these lymphatic massages. It don't really go too well. You're gonna end up with pockets of fluid. You can mess yourself up, you can mess your skin up. Just please let a professional do it. And also, like, if you're getting lipo, the massage guns can absolutely mess up your skin. So just don't even do it. I asked a few people, and I asked the girl that did my massage, and she said no, don't do it at all. It's painful, it can bruise you up, it can definitely tear up the skin, since the muscles and and everything did not connect yet. Just don't do it. So I really didn't want to make this video long. It's just something I wanted to touch on beforehand. Vitamins. I get it. Everybody is really like, hey, get your heme up. Make sure your heme is right. I know a lot of people take Floridex. They take, what is it called? I forgot the other pill for iron, like iron pills. Also, your regular supplements are really important as well. Just keep taking your vitamins, but you can actually overload on vitamins. So read the instructions. Don't just start taking a whole bunch of stuff. Check out your different options. Which vitamins do you get more nutrients from, versus taking what, 15, 16 pills? Some of it start to cancel out. Like, you guys really have to think about what you are doing, because I had a few girls, they don't know anything about surgery, but they made a deposit to go have surgery in a couple months, but you don't know anything. Like, it's really not safe. Surgery is not a game. Everyone might seem like they have surgery, but it's serious. This is life-changing. And it also, some of the people see these doctors that are killing these girls out here, and they still decide to go to them because they rather take that chance of, oh, if I don't die, I'm gonna come off the table the baddest thing, the best body ever. That's not smart. You never want to play with your life like that, because a lot of people always think it won't be me. It can't happen to me. It can happen to you. It can happen to anyone. So just honestly think before you do anything. Just please think before you do anything. Oh, one more thing, and then I promise I'm done. I said this video wasn't going to be long. At the recovery houses, so I've seen some people in surgery groups. There have been disruption and fights at the recovery house. Everyone is here to get better, to heal up, and to go home. Some of the recovery houses do allow the girls to bring someone to stay with them, whether it's a partner, a family member, someone. Just try to, the people that are bringing family members or anyone else to assist them, please be courteous to the girls. At least try to be courteous to the girls that are trying to get well. I get it. You meet a lot of good people. Like, the group of girls that I met, everybody was wonderful. Everyone was so nice. We got along. We still speak to this day. But just have that level of respect, because some of the stuff is getting out of hand. And I get it. You got people from everywhere meeting up and staying in one house. You don't know everyone that's there, but to be fighting at a recovery house, that's a little too far. Just please just have manners. Like, understand, be an adult. Be an adult. No one wants to think about, hey, I'm going to go to a recovery house. There might be a chance that I have to fight somebody. That's nonsense. That's crazy. I paid my money. You paid your money as well. Have that respect level. This is not a club. We didn't come here for a vacation. We're trying to get better so we can get home. Respect boundaries. Respect the space. I'm not obligated to come here and be anyone's friend, and neither are you. So don't expect someone to be overly nice. Long as someone don't disrespect you, they might be an introvert. They don't want to be bothered. They'll say hi and bye, and that's it. You can't get offended about that, honestly. So just try to be respectful when you're going into these places, especially a recovery house. Everyone deals with pain differently. Some people might be upset. Some people might be sad, homesick. You don't know what that person is going through. So for you to be rude, disrespectful, that's not okay. That is absolutely not okay. And it's a waste of money if you go there, you do that, and you get put out. You wasted your money. So that's really it for today. I'm on my way to work soon. So I hope you guys enjoyed this. This was just my little rant that I wanted to go on. Because I do appreciate the girls that have reached out to me, asked questions. Everyone has been so nice, so respectful. I appreciate it. If you have questions, message me on Instagram. I'm always going to respond. I respond. I talk to everyone. I let the girls know, hey, if you have an update, let me know. Message me. Okay? So I'm out. Wonderful YouTube world. The surgery girlies. Bye.